States opting to legalize the sale of medical marijuana, researchers are taking a closer look at the use of cannabis to treat chronic illnesses. Joining me now for an update is the medicine hunter, Chris Killam. From the medical marijuana perspective, so far as the treatment of chronic illnesses, as I said in the introduction, what is it about cannabis that makes it that special?
Well, it seems that there are primarily two things. There's the THC, that's what people associated with getting high. And that appears to have a salutary effect on the eyes in case of glaucoma. For people who are suffering from chemotherapy and can't eat, it helps to get their appetite back. And we also know that it is a potent pain reliever, and science on that goes back to the 1890s. But there's another agent in cannabis that is getting a lot more attention now, and that is called cannabidiol. And this is something that you can swallow it by the bucketful. It won't get you high at all, but it appears to have profound nerve protective and brain enhancing properties. And interestingly enough, it also induces anti-anxiety effects. In fact, there was even one piece of literature I read recently suggesting that what psychotic reactions have been reported among people who have used cannabis and then wigged out may be due to cannabis that contains no cannabidiol at all. So this appears to be a very important agent, perhaps useful in the treatment of neurodegenerative disorders. A lot of researchers are working on this
Are they
right now.
extracting that particular chemical off the...
There seem to be two pathways that people are taking. You've got like GW Pharmaceuticals in Britain that has come out with a whole cannabis fluid spray. You've got people also isolating cannabidiol and playing with that in the lab. I don't know how this is all going to settle out. I mean, as a whole plant person, I'm inclined toward the whole extract. But it does appear that this may also have anti-cancer properties.
Breast cancer kills more than 41,000 American women every year. Researchers in the San Francisco lab are working to shrink that number, and they're doing it with an unusual weapon, marijuana, or at least a compound from it.
And what we found is that this compound called cannabidiol was particularly effective at inhibiting aggressive breast cancers.
First, scientists at California Pacific Medical Center discovered a key gene which enables breast cancer to spread. Then they tested the pot compound and realized it could actually inhibit that gene's destructive path and stop the spread of tumor cells, and potentially do it without harming a patient.
We know that this compound extracted from cannabis is non-toxic in patients because it has already been used for different kind of disease.
The benefits may not stop there. Scientists say the cannabis compound may fight other aggressive cancers, including prostate cancer. The next step, animal studies, then clinical trials. So it may be several years before patients may benefit from a cannabis cancer fighter.
I think it's a promising avenue in terms of the treatment for aggressive cancers, and which is really where we need treatments.
One of the interesting stories is Manuel Guzman and his research team in Spain were looking at brain cell metabolism, and they knew that THC had been found to work with receptors in the brain, so they were curious how THC affected brain cell metabolism. The studies they were doing were done with brain cancer cells because they reproduce really quickly, and you can have a line of cells to study without having to keep buying normal cells. You have your own dedicated line reproducing really quickly, and it's much cheaper than buying them, and you can get basically the same data. So when they started trying to research THC with brain cancer cells, they couldn't do the research because all the brain cancer cells died off. And they, what's this about? They tried again. Brain cancer cells died off, complete death. So they said, wait. They went to the literature, they found the study from 75, so that gave them a clue that they're, what they were seeing was valid. And they redirected their study away from brain cell metabolism into cancer, brain cell cancer, and how cannabinoids affect it. And they found that THC and synthetic cannabinoids have the ability to change the signaling at a genetic level so that the cancer cells change their biochemistry. Instead of making pro-survival chemicals within the cancer cell, the genetics are flipped so that they start making chemicals that are hostile to their survival, and then they die off. Another thing that the cannabinoids do is to impede the ability of tumor cells to produce blood vessels. In order to eat, because they divide rapidly, they need a lot of nourishment, and that's why cancer patients waste. These tumors tap into the host and suck the blood. They're vampires. They drink, tap into the blood system and draw off nutrients. THC inhibits the ability of the cancer tumor cells to produce a compound necessary for producing these blood vessels. This inhibits their ability to thrive and to spread, and once they spread, to get a doc and to survive as a metastasis. So they were really amazed by this and continued their research, and once they published, other researchers started looking at it, and they found similar activity for breast cancer cells, for colon cancer cells, for head and neck cancer cells, bile duct cancer cells, pancreatic cancer cells. So many different lines of cancer cells all responded to THC or synthetic cannabinoids.
My name is Shauna Banda, and I was diagnosed with Crohn's disease about 9 years ago, and had every condition that you can think of I've endured. I went through the beginning stages of the disease, where I was having strictures or blockages in my bowels, with surgeries and drugs to fix that, all the way to the terminal stages of the disease where I was losing weight quite drastically, and my body was starving because any food that I ate was gone within minutes, and my body just wasn't able to absorb any of the nutrition that I was trying to give it. I was so sick for just so long that as soon as I tried the oil and started feeling way better, that there was no turning back. That was it. That was it. No medication that any doctor had ever given me had worked that well for any reason. I'd watched Rick Simpson's movie, and I was in Kansas, and you need a whole pound of it to make the 2 ounces to cure you, and I cried. And I was like, there's no way. And I accidentally found out how to do it with a little $50 Gladstone vaporizer and a $5 spatula. Scrape that stuff out and scoop it into a pill and eat it 3 times a day. And it's just amazing. It really is. I really was on my deathbed, laying there in my bed just waiting, because I was in and out of the hospital so much and out of the emergency room that the last couple of times I had went in, there's nothing that we could do for you. And I'd gotten to the point where I didn't want to be a burden, didn't want to do anything, so I was just literally waiting to die. So, and that's when I accidentally found the oil. And really, within 3 days, I was able to no longer need the use of my cane. I could stand upright, and that was it. My life changed forever.
cancer cells are killed by marijuana, while the other healthy cells are left untouched. Cells that stop moving and become still white dots are dead cancer cells. The ability of cannabinoids to kill bad cells while protecting healthy ones is particularly important when we're talking about brain cancer because of the so-called blood-brain barrier. The brain has to be sheltered from outside influences that might hitch a ride on the bloodstream and cause havoc. What is exciting and unique about cannabinoids is that they can pass through the blood-brain barrier because of their slippery, fat-loving nature. Cannabinoids get right into the brain's cancer cells by moving easily through the cell's membranes, which are also composed of lipids. The evidence is piling up in mice-infested labs that the endocannabinoid system, when stimulated by cannabinoids, has an anti-tumor effect and can instruct cancer cells to commit suicide.
This was done by Manuel Guzman's group within the past less than 10 years, and what they showed there was that originally that THC, when injected into a brain tumor in mice and rats, a significant number of those animals the tumor would regress.
Day Mike and Callie Hyde will never forget.
He was just a healthy little boy, born there in Missoula.
Cash Michael Hyde's very first birthday, a family now complete. They never could have imagined the journey little Cashie's life would take.
He was just your average, happy little kid, and then he just started to get sick.
It was shortly before Cashie's second birthday when Dad Mike knew something wasn't right.
Well, he started being very tired, sleeping a lot, very cranky. He started to throw up. We started taking him to the doctor, and the doctor would tell us that he had mono.
For 6 weeks, it was the same diagnosis over and over. But Mike refused to accept what doctors were telling him. He knew, like any parent would, that something was terribly wrong.
I was like, it feels like he's dying in my arms. We need to take him somewhere else, you know. And so we took him to the ER, and that's when they did a CAT scan on him, and they found a 4.5 centimeter tumor in his brain. They loaded him up, and they were gone to Salt Lake City within a matter of a couple hours of finding the tumor.
At Salt Lake's Primary Children's Hospital came the devastating news. Their little boy was facing incredible odds. Brain surgery revealed a peanut tumor wrapped around Cashie's optic nerve.
When we arrived in Salt Lake in May, Cashie was so sick that I mean, his eye was starting to get pushed out. He was sleeping 16 to 18 hours a day. He was vomiting. He was pretty much as sick as, you know, you can get without being, you know, on your deathbed.
Doctors cut into Cashie's brain to remove what they could, only about 10% of the tumor. The Hydes could only hope aggressive treatment could get the rest. 3 rounds of chemo followed by stem cell rescue, then 3 rounds of high-dose chemo after that. A difficult treatment plan for anyone, so imagine what it did to a 2-year-old kid.
So the first night of chemo, we did 10 hours worth of seizures down in the ICU. And, you know, the doctors told us then he could have brain damage from these seizures. We don't know where it's going to be in the morning. Just going to have to wait and find out.
Cashie spent his second birthday in a hospital bed, swollen and sick from the medication intended to save his life. Doctors were uncertain he would make it to his 3rd birthday.
It's overwhelming, I guess, to say the least. And we had a lot of scary things happen in June. He got a blood infection, went into septic shock, went to the ICU, ended up coding, and they had to resuscitate him. I was standing like 2 feet away. I had to watch the whole thing. There was a lot of days we were getting told we weren't going to beat it. You know, you're not going to take him home. He is going to die. And those are the days where you really got to really believe.
They believed and they prayed. High-dose chemo was killing his cancer, but it was making Cashie sicker than ever. He was taking 120 milligrams a day of 5 different drugs to try to make him comfortable. But that, Mike said, wasn't helping ease Cashie's pain.
That's going to help get the tape off.
I'm going to hold this, okay?
By the end of September, he had gone 40 days without eating. He was vomiting 9 to 10 times a day. He couldn't lift his head off his pillow. He was literally laying there shivering in his bed. And the doctors came in, and I said, is there anything we can do for Cash?
The doctors had no answers, so Mike found his own. Relief in the form of a controversial oil, cannabis, illegal for you and I to possess, and something Cashy's doctors wouldn't even discuss. Mike got authorization to give Cashy the oil, and without telling them why, he told the doctors to wean Cashy off the nausea cocktail. Inserted through Cashy's feeding tube, a tiny amount of oil replaced all those drugs. The result, Mike says, was almost immediate.
You're watching a kid that hasn't had the will to eat in 4 months, 5 months, actually take a bite of something. He hadn't eaten a thing in 40 days, and it was really incredible just to watch him take a bite of a piece of cheese, you know. It's showing that he wants to live. There you go.
Cashy did his last round of high-dose chemo with no anti-nausea drugs. Mike says the doctors told him they were amazed. Mike never told them why.
I wanted to tell him, hey, he's on cannabis oil, but I was afraid they would take it away from him.
We wanted to tell you about the side effects, the possible dangers of giving medical marijuana to a kid as young as Cashy. But even though it's perfectly legal in Washington and in his home state of Montana, we couldn't get a single doctor to talk to us on camera. That's how we ended up here at the THC clinic in East Spokane.
And I see a lot of folks, and they come in from all walks of life and say they receive benefit.
Sherry Allen is a nurse practitioner from Oregon. She comes to Spokane every couple of weeks to evaluate medical marijuana patients and sign off on their permits.
What I try to do here at this office is create an atmosphere that is truly medical, because I do believe that cannabis is a medical, and we are trying to use it as a medicine.
She believes in the power of this drug and its benefit for cancer patients. She signs off sometimes on 50 patients a day. Then I asked her about authorizing marijuana for kids.
It is not common, okay? And I'm not going to say whether or not I've authorized for a child.
It's a typical answer, as doctors are concerned about federal law and company policies. But Mike Hyde doesn't care about the controversy or about the political battle over this drug. He cares that his son survived and is convinced not only did the cannabis oil make Cashy feel better, it prevented long-term damage to his organs. For Mike, the living proof is in this vibrant 2-year-old boy.
Yeah, it's very controversial, it's very scary, but there's nothing more scary than about losing your child.
A week after we did this interview, Cashy was back in Salt Lake for scans, finding out he's cancer-free. He's back home in Missoula, back with his family, back to teasing his big brother Colty. Cashy will spend his 3rd birthday like every kid should, with the fight of his life.
14 different prescriptions, and I would still have up to 12 seizures a day. I used to take 2 handfuls of pills, no more.
While this 27-year-old epilepsy patient in Montana is relieved to be taking medical marijuana,
I'm not using it to get any psychological effects off of it. I'm just eating the butter raw with bread.
She's considerably more anxious about showing her face and has requested we conceal her identity.
Why do you not want to show your face?
I am not comfortable showing my face because of all the discrimination that has already happened.
She says both she and her husband have lost jobs when she spoke openly about using marijuana to treat her seizures. Medical marijuana use has been legal in Montana since 2004, when voters there approved an initiative allowing doctors to recommend it to their patients. However, the federal government still classifies the plant as a Schedule I drug. That makes it illegal for doctors to prescribe it, and it means state law does not protect patients from federal arrest and prosecution.
But the fact of the matter is, somebody has to speak up or nobody will hear these stories.
She told us her story in her artist's studio. Here, she creates much happier works than she did even a few years ago, when her self-portraits plainly showed the toll epilepsy had taken since she was diagnosed at 15.
I've taken pretty much every anti-epileptic on the market, and some with a little bit more success than others.
None of them stopped her seizures, and by her early 20s, the epilepsy had also spawned depression, anxiety, and insomnia. She had to withdraw from college just a few credits short of a fine arts degree. Unable to hold a job, she was bedbound for years, while the epilepsy ruled her life.
It's not a life to live like that.
Then she remembered reading stories about the potential of cannabis to treat epileptic seizures, and she desperately wanted to try it. But her home state does not have a medical marijuana law.
So I did what I could do. I moved to the state where I could treat it myself.
Medical marijuana critic Dr. Eric Voth says the problem is patients are treating themselves with a plant that's voter approved, not FDA approved.
So much of the medical excuse movement has come through ballot initiatives and legislative initiatives, and that's not the way we bring medicines to market. We bring them to market through the FDA in a very careful process of proving safety and efficacy.
Dr. Voth is an addiction and pain specialist in Kansas, and he's also the chairman of the Institute on Global Drug Policy. He says scientific research is the only legitimate route to understanding marijuana's medical potential, not a hodgepodge of state laws and anecdotal stories. He says when patients smoke or ingest marijuana, they're getting a complex and largely unresearched mix of chemicals known as cannabinoids.
If we're delivering THC, which is the major active ingredient, shouldn't we be delivering that alone or other cannabinoids alone? But in fact, what we're doing is we're delivering not only one, but 66 cannabinoids. On top of that, we're delivering hundreds of contaminants.
This epilepsy patient says she's willing to take the risk because something in that cornucopia of substances has changed her life.
How did that impact your seizures?
They started slowing down. I had to build it up in my system, and it wasn't until I started ingesting it that they really stopped completely.
I'm very suspicious about it because for someone to have been on 14 medications and not solve her problem and then have this miraculous benefit from one medicine, I just find that suspect.
But the potential of marijuana to mitigate epileptic seizures has been recognized by the U.S. Institute of Medicine. The Institute has released 2 reports on the therapeutic potential of cannabis. The first report from 1982 found substantial evidence from animal studies to indicate that cannabinoids are effective in blocking seizures. Scientists who wrote the 1999 report also found marijuana had anti-seizure effects, but doubted it could be developed into a pharmaceutical-grade epilepsy drug. However, both reports detailed the promising ability of cannabis to treat pain and disease differently than conventional pharmaceuticals. That's exactly what scientists at the California Center for Medicinal Cannabis Research found during several placebo-controlled clinical trials. Dr. Igor Grant is the center's director, and he says marijuana is not just an anti-nausea drug.
I can say that the cannabinoids are almost certain to be useful in pain based on the research that we've done, and probably have a place in muscle spasm.
Marijuana contains anti-inflammatory, antioxidant, and probably anti-cancer compounds in it.
Dr. Donald Abrams is an oncology physician who conducted some of the center's clinical research. He agrees the cannabis plant is a complex mix of substances, but he believes this is a medical benefit, not a detriment.
I'm a cancer doctor, and I often suggest to my patients that they consider marijuana for their loss of appetite, nausea, pain, depression, and insomnia. It's one medicine they could use instead of 5.
Critics like Dr. Voth are especially skeptical of these kinds of claims. How is it possible that one plant has the potential to impact so many different ailments? Intriguing answers started appearing in the early 90s when researchers pinpointed receptors in the brain and the body that bind with cannabis. Receptors can be described as locks on the surface of a cell, and when the correct key binds with the correct lock or receptor, it opens the door and delivers messages. Sometimes the messages are urgent. For example, that the body is feeling pain or that there's an invader and the immune system must attack. Researchers believe cannabinoids can turn down those messages, helping to temper chronic pain and autoimmune disorders. These special receptors are extremely abundant in the brain, but they're also found all over the body and in the major organs, the heart, the liver, kidneys, and pancreas. After finding all these locks that accepted the cannabis key, researchers made the next big discovery. The human body makes its own cannabinoids.
We have these circulating chemicals that we produce ourselves that really are very, very similar to the chemicals in the marijuana plant.
The only difference is that the cannabinoids that we produce are in such small quantities, and they're also rapidly degraded, so that therefore we are not high all the time.
Dr. Prakash Nagarkati is a professor of pathology and microbiology at the University of South Carolina. He's one of many scientists in a race to unlock the mysteries of the receptors by using newly created synthetic drugs instead of tightly restricted whole cannabis. These synthetics have made research much easier and potentially lucrative. The U.S. patent database shows numerous large pharmaceutical companies have filed recent patents claiming their cannabinoid receptor drug has the potential to treat almost everything: multiple sclerosis, Alzheimer's, Parkinson's, rheumatoid arthritis, Tourette's, epilepsy, heart disease, obesity, various mental illnesses, and the holy grail of medicine, a cancer cure. Dr. Nagarkati and his team of researchers were one of the first labs to prove a cannabinoid key can seek out a cancerous cell in the immune system, unlock the receptor, and direct the cancer cell to self-destruct.
So basically telling the cells to commit suicide.
Dr. Nagarkati's experimental drug was able to eradicate almost 100% of the cancer in test tubes, and when they moved on to live mice,
to our surprise, we found that almost 25 to 30% of the mice completely rejected the tumor. They were completely cured.
Tumors in the rest of the mice shrank significantly. The results have been so promising that Dr. Nagarkati is already beginning clinical trials with leukemia patients. Dr. Voth believes researchers like Nagarkati are headed in the right direction.
Let's keep it in the corridors of science. Let's keep it in the FDA. Let's deliver what's really medicine. That is the individual cannabinoids.
Because the spasms, your muscles.
But this epilepsy sufferer says patients cannot afford to wait on science.
I don't know how long it's going to be before they really find out exactly what is working.
Does that make any sense to you?
The war on drugs has been an utter failure.
Don't put the livelihoods of thousands of people at risk. Don't put projects at risk.
I was in Washington, D.C., helping them try to implement their law, which they passed. And I was speaking before in front of the city office, the city major, whatever it is called, where the city council meets. And, you know. Anyway, so since we had cameras there and since I was in D.C., I feel it was a good time to make my plea to Obama. And what I basically said was this: President Obama, you don't even know I exist. You don't know who I am or what I stand for. But I am a federal patient. You probably didn't even know that there was a federal patient. You probably don't even know that the federal government grows cannabis and supplies to patients. I said, you don't even know that. I said, but here I am. I've been getting it for almost 29 years. Now, how old are you? You just turned 50. So I've been getting it over half your life. I've been getting cannabis. But yet, your administration, along with FDA, just came out saying it has no medical value. Well now, my bone disorder is such that I'm lucky to be alive. And if I were alive, I'd be lucky to be out of bed because of my bone disorder. But I'm a very productive member of society. I'm a stockbroker. I handle a lot of money on a daily basis. I teach children and adults with mentally and physically challenged kids and adults how to sail with an adaptive sailboat program called Shake a Leg in Miami. In fact, one of the groups we work with is Wounded Warriors. We have a lot of your wounded people. And speaking of that, guess what? The VA, the Veterans Administration, just came out saying, well, 9 months ago or so, that in the states where they have medical cannabis, that if a veteran tests positive for cannabis, that they cannot withhold opiates. So even the VA is recognizing the use of cannabis, but you haven't. The AMA, the American Medical Association, largest organization of doctors in the country, the ANA, the American Nurses Association, the largest organization of nurses in the country, have sanctioned patients at a time, my organization, to teach doctors and nurses about medical cannabis, to where they get continuing education credit. Well, why would the AMA and ANA want their doctors to learn about a medicine if it's not a medicine? I said, you know, I don't know what kind of medical degree you have or some of your advisors, but all I can say is I'm a patient. I've been using it for almost 29 years. I'm real. Okay, I exist. I've just come out with a book called My Medicine. You should have your people look at it. Okay? I was the second patient in the country to get it, and I'm the longest surviving now. President Obama, I'll give you a fallback position. We don't know. When people talk about we need more research, that means more prohibition. You know, the federal government's never researched me in 28 years. They've never researched any of the patients. And why is that? The government's supplying it. Wouldn't you think the government would want to know if it works or not? But they haven't. Okay, so you need more research. Okay, let me give you an idea. Why don't you take 50 research centers in this country, one in each state. Let them pick 50 patients that supposedly cannabis works for, such as Crohn's, such as anti-nausea chemotherapy, such as glaucoma, and I can name a bunch more. And let them be studied for 2 years, compared to their peers that aren't using cannabis. Let these research centers do that. And if President Obama, you're right, and all the people that are against me are right, at the end of 2 years, we're going to prove that we've only harmed 2,500 people. That we've been able to prove that cannabis doesn't work, it's not good, and thank God we've only harmed 2,500 people to do this. But what if at the end of 2 years, those patients are doing better than their peers? Well, then when you finally recognize the use of medical cannabis and make it legal for everybody, so doctors can use it. That's my challenge to you, okay? That's my challenge to you. This can be done. But the medicine's being grown. Doesn't cost much more to grow it for 2,500 patients. You can easily do it on the farm. And once and for all, let's look at the pharmaceutical lobby industry. Because again, President Obama, I'm 58 years old. If this happens to where it becomes available for every patient, I don't get a dime out of this. The only people that are against this are the people that make money out of the prohibition of cannabis. That's mostly your politicians. They get paid by the pharmaceutical lobby, by the lumber lobby, by the petrochemical companies. Okay, they get all these lobby organizations pay them to keep cannabis and hemp from being legal. I said, so if you want to be the leader that you are, then say, hey, look, let's really research this. Let's really do this. And I think if you really do this, you're going to find that I'm right. Because it's been a miracle.
I live in a state that has no medical marijuana protection. I was I'm born with cerebral palsy, which most noticeably manifests itself in a severe stutter, and the right side of my body is much noticeably weaker than my left. I have the stutter has got to be one of the most stigmatizing disabilities invented by God. It's very humiliating. My right arm is always very painfully tense. I went through my entire childhood in pain because I couldn't move my muscles. The first time I realized that cannabis helped me was the first time I smoked it. It's been 3 days since I smoked. I am hoping to find something in Kansas City. I smoke to be the mother my children deserve, because they're really cool kids. I'm in downtown Kansas City, looking for cannabis.
Why?
Because I hate the way that I stutter, and it's the most effective treatment that I've found. If I were to get busted buying or smoking marijuana, there's a possibility that I could lose my children.
But it's worth that risk?
I wouldn't be half the mother I am without it, because I would just be in way too much pain. So yeah, being a good mother to my children is the most important thing in the world to me. After about the third hit is when I began to feel the tension dissipate. It really helps my speech. I feel much calmer, much less rushed, and I feel like I can control the muscles that I couldn't control before I smoked. It's kind of nice. I don't make as many funny faces.
This week, efforts to legalize medical marijuana move forward in Alabama and Kentucky. There's evidence it can help people with arthritis, Alzheimer's, asthma, even glaucoma, and epilepsy. Tracy Pott shows us why some people are pushing for it while others think it's still dangerous.
3-year-old twins Nicholas and Byron Delianis have a rare genetic disorder. They can't walk, they can't talk, they're fed through tubes, and they have dozens of seizures every day. Medicine doesn't help. Most children with this condition don't live past 2 years old. Their doctor told Mom it's time to make some decisions.
She told us that we had to choose now between quality of life and quantity of life. And I said, not now, not yet.
Some studies show marijuana can help control seizures, but medical marijuana is illegal here in Maryland. Their mother's fighting to change that.
If medical marijuana is saving the lives of children in places where it's legal, I'm going to do my best to make sure that it's legal here.
Medical marijuana is legal in 20 states and Washington, D.C. Maryland's considering it, so are 15 other states. But the federal government, including the FDA, says no, arguing it's addictive, unproven, a gateway to more dangerous drugs. Research is split, and so is the medical community. Even where medical marijuana is legal, it's complicated.
How much marijuana could a person grow exactly? What about if a person is arrested? What about the risk of driving under the influence? A lot of states haven't quite nailed down how to deal with that.
Even if Maryland approves medical marijuana, it may be too late for these twin toddlers counting on an illegal drug as their last hope.
My name is Michael Krawitz, and I am Executive Director of Veterans for Medical Cannabis Access. I am a medical cannabis patient. I didn't know it at first. I became injured in the Air Force while I was on my way home from dinner, actually, on coral-packed roads with poor lighting in Guam. It was my last Friday night on Guam, getting ready to move my station back to the United States, and I had a big trip planned where I was going to travel around Asia and then get back to the United States. And as a celebratory dinner, just as a little thing, my buddy let me drive his brand new motorcycle home from dinner. And because I was on his brand new motorcycle, I was taking it easy in the right-hand lane. And that just incidentally happened to be a lane that ended with no warning and no signs, no lights. And I just got broken up pretty bad. I lost my spleen. I fractured my left arm. I broke my hip, and I just smashed my lower leg. And then I had about 13 surgeries in all, inside the Air Force and out in the VA, to put me all back together. All of a sudden, I was a disabled vet. And it's not like back then, there wasn't even the words medical marijuana. This is all in the 1980s. My accident happened in I think it was 84. So you're talking about a very long time ago, before this medical marijuana movement that we now know of really was started or existed. It started, but it didn't really exist like we know it now. And I basically went through every treatment that they had at the VA, which is a whole lot of treatments. I mean, probably 30 treatments in all, not including varieties of the same treatment, like 10 different NSAIDs or things like that that they tried me on. So there's drug treatments, dozens of them, and then the non-drug treatments, the kinesiotherapy and the aquatherapy and the ultrasound therapies and all these different things to try to remove pain and deal with these issues over time. But process of elimination just basically found very few that would work. Winding up using opiates, but cyclically, because I've got internal injury, I really can't tolerate it. So I wound up using it a little bit when I absolutely needed to, and then having to deal with the fallout of that. I was now disabled, defunct. Why not pick up a marijuana cigarette, right? So it really was kind of a genesis of realizing that this marijuana that I was using was actually making me feel better. I mean, you use it and you stop using it and you, wait a minute, I now am suffering a lot more, and you use it and you're not, it doesn't take you long, process of elimination, to figure out it's actually working. You don't need someone to tell you that cannabis is medicine. You can figure it out on your own when you're suffering, and you just use it for a while and then you don't use it. And when in the drug war, that's a regular occurrence. I mean, it's only available when it's available. In the black market world, without a dispensary that you can reliably get medicine from. That's the world that we lived in, Cannabis has been, it's difficult to describe life with or without, because there is no life without it. You die. Pain isn't the kind of thing like post-traumatic stress that'll just kill you so suddenly as killing yourself or killing others and getting killed by the cops or some of these terrible scenarios. It's like water torture. And you just don't go that far before you're done, And I have family in Virginia, and it's tough to have to go through this roller coaster ride of pain. You can't function. And then you have cannabis, you can function, but what can you get done in that short period of time? It's like this geometric puzzle of life that you just can't solve. And life is hard enough for a veteran without having to deal with that. So I thank cannabis for giving me a lot of my life. It's something that doesn't just improve pain and doesn't just help me with eating and sleeping. It just it lifts the misery away. And it just really helps in a way that other drugs don't seem to touch. It's a pain reliever together with opiates. Again, there's nothing else. I've been through all these other treatments that are available. There's nothing that